listening out here on this very beautiful question answer session on the topic early initiation with empagliflozin and linagliptin combination for optimal glycemic control in diabetes management. To answer my questions, we have a very pioneer speaker and pioneer diabetologist of my city, Kanpur. He is none other than Dr. Saurabh Mishra, who is consultant physician and diabetologist at Center for Diabetes and Endocrine Diseases, Swarupnagar, and he is head consultant physician and diabetologist at RKM Center for Diabetes and Related Disorders, Unnao. So I welcome you, sir, on this very beautiful evening.
Thank you, Sachin.
Moving forward, sir, to my first question. How early would you add and fixed dose combination after metformin in your clinical practice, considering many diabetic patients have a very high baseline at the time of diagnosis or presentation at the OPD? Sir, your answer on this?
Okay, thank you, Sachin. Thank you, the organizers, for organizing such a nice interactive meet, specifically to address upon these two beautiful molecules, empagliflozin and linagliptin, which are very near dear to my heart. I have been prescribing these two beautiful molecules for management of uncontrolled diabetes of our people. And mind you, Dr. Sachin, who is today as an interviewer, specifically he is working with me since past many years, and he also understands what is the importance of early initiation of drugs which are going to have robust management in controlling diabetes and bringing into euglycemic condition. So irrespective of any other thing, when a person enters into our clinic at the point of care, when we come to know about micro or macrovascular complications, it becomes our due responsibility for not let that micro or macrovascular complication to enhance or to progress further. So what are certain drugs which, apart from having good glycemic value control values, they have some other protective natures also, like linagliptin and empagliflozin? When combined together, they have a very robust management over HbA1c. As we know in UKPDS, which is a very good study, irrespective, we have seen that if there is a very intensive management for uncontrolled diabetes in our part and specifically all over, it was seen that there was a good legacy effect. Legacy effect means that is the effect when you initiate a drug, and after initiating, when you intensively manage, that drug gives some more positive results. So when I see a person on metformin in my clinic and is not controlled, having HbA1c on higher side, and the next thing which strikes in my mind is that is there any need to evaluate the side effects or contraindication of this fixed dose? If it is not, then just prescribe it at the second point. So what I do, I prescribe this beautiful molecule to each and every person just after metformin to get a robust management and intensive management, which will definitely have good results in just stopping the progression of micro and macrovascular complication. So I think so, Sachin, this will answer the question which you had asked.
Yes, sir, you have beautifully answered this question, so clinically explained. So moving towards the second question is, how does the evidence with EMPA and LINA combination help us choose these patients for optimal glycemic control and cardiovascular risk reduction as well in patients with type 2 diabetes? Sir.
Okay, definitely. This is a very good question. Irrespective of all the things, you have specifically focused on cardiovascular risk reduction. So the people whom we have a good family history, that they are having some family history where any elderly people had some cardiovascular risk, or might be themselves, they have met any type of cardiovascular incidences, or might be their lifestyle is not good, BMI is on higher side, blood pressure is increasing, or if you have available ejection fraction is not good, it is preserved, or it is reduction also, it is normal ejection fraction. In all these combination, now we have very good data on Emperor trial and all those. These all combined together for this particular fixed drugs effect, that they both, when combined together, have a synergistic action also, and when they both combine together are very much renal, metabolic and cardiac safe also. So for protection and having extra cardiovascular protection, I have to start these fixed drugs combination at a go. Definitely all these trials which have been summed up, now it is a recommendation for any type of heart failure due to reduced ejection fraction or preserved ejection fraction or normal ejection fraction. If you want to preserve the myocardium, you can start away, write this fixed dose combination just after metformin, and you will protect the person, and you will also have euglycemic conditions achieving very earliest. Now over here I would like to say the beautiful nature of this SGLT2 empagliflozin is like that the efficacy result is similar to aspirin. Do you see that we have been using ecosprin since past many years for protection? It has been seen the efficacy of this blood thinner which is achieving the same way it is also seen with empagliflozin in on-arm, giving the same type of effect. Now all my cardiac physicians or experts who are treating people with cardiac diseases have recently taken this drug into their armamentarium for initiating for cardiac patients also. So definitely when it is a part of cardiovascular safety, this drug, this fixed dose combination plays a very synergistic role, and it is definitely recommended by all the authorities like ADA, ESD, RSSDI, specifically whatever you want to say, atherosclerotic cardiovascular disease with heart failure or people with CKD. Specifically, we have certain other drugs which at present do not serve the purpose in pharmacoeconomics of our country. Yes, I think so. It will answer your question, Sachin.
Correctly, sir. You have said it so nicely, so extensively explained about the combination, where to choose, and what is the cardiovascular safety of this drug. Sir, moving towards the next question, what are your thoughts on early intensification with single pill combination of Empa-Lina as an add-on to metformin?
Definitely. I think so. The 50% part I had covered in my first answer, but definitely again answering, as you can see, intensification with specific pill combination, that is when pill burden is low. If you want to give SGLT2, you will give a pill. If you want to give linagliptin, you will give a pill. So 2 pill burden shared in an equal, it has been a boon just after metformin. A single drug after metformin will serve the purpose. HbA1c level will be on down. The goal for HbA1c in our country, all throughout the world, is seen it should be below 7%. And what is the incidence of people who are coming to us in our OPD for getting the treatment started? It is above 8.5. Approximately in India, it is nearing to 9% also. And there are certain people whom they are experiencing specific targets also. They are having CKD problems. Might it be, suppose a person is coming to your OPD, you don't know exactly about his renal parameters. So what is the safe to start? You don't know about his cardiac parameter. What is safe to start? So as this fixed dose available, it is very much necessary to intensify your treatment with this, not only with metformin. After metformin also, if you are giving some sulfonylurea, if you are giving insulin, and then still you have not prescribed this fixed dose combination, or you are not writing SGLT2 and DPP4, we can start right away and add this pill, and it is giving a good result, especially in all my people whom I have started this fixed dose with Lina and Empa. Yes, Sachin.
Thank you, sir, for this answer. Now moving towards the last question of today's session. Sir, it is about what are the considerations in terms of patient factors you will think about while initiating this therapy in patients. And sir, to add on this question I have is specific concern on UTI for this regimen to be followed. Sir, please.
Okay. It is good question, and your added question is also good. So specifically, first of all, talking about UTI, whenever you have to prescribe any SGLT2 inhibitor, you have to take some time. You have to take some time for counseling this beautiful molecule. Otherwise, due to a same specific complication, UTI, a beautiful molecule, will always be adhered, not adhered properly. Medicine non-compliance is the basic need of the day which has to be catered. So what I do, I am going to tell it in the regional language. मैं बोलता हूं, देखिए मैं एक ऐसा सुंदर सा ड्रग आपको चालू करने जा रहा हूं मैडम या सर, जो कि आपकी एक्स्ट्रा शुगर को पेशाब से बाहर निकाल देगा. तो कृपया करके इसके और भी 3-4 अच्छी चीजें समझें। ये वेट कम करने की प्रॉपर्टी रखता है ये मॉलिक्यूल हार्ट के लिए एक्स्ट्रा प्रोटेक्शन देता है, ये मॉलिक्यूल किडनी के लिए एक्स्ट्रा प्रोटेक्शन देता है, ये मॉलिक्यूल आपके सिस्टोलिक ब्लड प्रेशर को भी थोड़ा अच्छा रखता है और एक्स्ट्रा शुगर को पेशाब से बाहर निकालता है, इसलिए हाइपोग्लाइसीमिया होने के चांस नहीं है। बस इस मॉलिक्यूल का एक ये इफेक्ट है कि चूंकि ये शुगर पेशाब से बाहर फेंकेगा, तो आपको जितने बार आप पेशाब जाएंगे, पेशाब के रास्ते को धो देना है और सूखा रखना है। सो इट इज नोन एज यूरिनरी हाइजीन। बस इतनी देर, 1 मिनट, अगर वी विल टेक ओनली 1 मिनट to explain the same thing to our people whom we are starting SGLT2 inhibitor, UTI will not be a problem for them. They will manage the things very nicely and this beautiful molecule will not be stopped. So with the combination, this DPP4 and this combination of SGLT2, it has proven with somehow the growth of bacteria was not seen much with both the drugs when used easily together. So it was also a plus point when DPP4 inhibitor and or you can say Lina and Empa, when they are given together, their synergistic action, their mode of action, their mechanism of action is seen that there were less result of UTI as compared to individual SGLT2 given. So definitely fixed dose combination will cater UTI if it is in how anywhere also. So UTI is not a problem. It can be managed very properly. If proper education is given, it will not occur. Hone hi nahi denge, it will not occur. UTI will not occur. We will not stop this beautiful molecule. Second, what are the considerations whom patients will be taking? So what will be the considerations? Those patients who have brittle diabetes, that means their up and down excursions are more. They may be more prone to have hypoglycemia. So the episode of hypoglycemia will be less. People who need extra cardiac protection, it will be there. People who are obese, we can see there will be a weight reduction also. People who are taking antihypertensive medicines, we will see that they will also be having a beneficial effect. So all those people who are taking any type of dyslipidemia related problems, having atherosclerotic cardiovascular diseases, those people we have to keep in special considerations. Those people whom we have to save the beta cell mass also, those people also will be kept in consideration while prescribing this beautiful molecule. So this beautiful molecule in combination with Lina and Empa is very, very near dear to my use, and I have been using in many patients, and it has given very good results. So these were some patient considerations which we should keep in our mind right away when we have to prescribe any drug just after metformin or any other drug to just cater and bring euglycemic conditions. Yes, Sachin.
So, sir, I think after listening to this session, whoever will in future listen to these kinds of sessions from you will have no doubts regarding Empa and Lina combination for optimal glycemic control. So, from my side, I thank Dr. Saurabh Mishra, sir, for answering my questions and joining this session. And secondly, I would like to thank Lupin and Synox division for giving us this very beautiful molecule in our armamentarium so that we can write it, prescribe it, and just signing off from this session. I just again thank you, Dr. Saurabh Mishra, sir. Thank you.
Thank you, Sachin, for such an interactive session. And Sachin is a very good emerging physician of our state, and may God bless you. Thank you.
Thank you, sir.